Watching worrying changes in an elderly loved one can be painful, especially when we dismiss them as just aging. Many assume decline is sudden, but the body often whispers warnings months, even a year beforehand. Missing these whispers can lead to regret and lost opportunities for meaningful connection. This guide explores 5 key signs, often overlooked, that may appear in the final year. Recognizing them isn't about dwelling on the inevitable. It's about empowerment. It gives you the precious chance to provide better care, ensure comfort and dignity, and prepare emotionally. Understanding allows you to make the most of the invaluable time you have left together, fostering peace instead of being caught off guard. Let's explore these signs with compassion. Before we get started, I'd love to know where you're joining me from today. Drop a comment below and feel free to ask any questions you have. And don't forget to hit that subscribe button and turn on notifications so you never miss a health-boosting tip from Elders Guidance. Let's start with a key sign: significant, unintentional weight loss. This isn't about losing a few pounds deliberately. It's a consistent, noticeable drop on the scale or in how clothes fit, happening without your loved one trying to lose weight. You might see looser clothes or notice a gradual slimming down. While easily dismissed as normal aging or reduced appetite, substantial weight loss without effort is rarely benign and often signals deeper physiological changes. What underlying reasons cause this? Several factors can contribute. Impaired nutrient absorption. The aging digestive system may become less efficient at extracting vital nutrients, even with adequate food intake. Accelerated muscle loss. Muscle loss, sarcopenia, can speed up considerably beyond normal aging, affecting strength, mobility, and protein processing. Metabolic slowdown. The body's internal engine slows, requiring less energy and changing how it uses nutrients, conserving resources. Diminished appetite and sensory changes. Appetite often genuinely fades as taste and smell dull, making food less appealing. People might feel full quickly, possibly signaling the body's reduced need for fuel as it prepares to slow down. Underlying medical conditions. Unexplained weight loss frequently signals chronic illnesses like cancer, heart failure, kidney disease, or COPD, sometimes before other symptoms appear. Conditions like depression, memory loss, dental issues, or difficulty swallowing also contribute. This puts caregivers in a difficult position. Your instinct is to encourage more eating. However, if weight keeps dropping despite offering favorite foods or supplements, the issue might be more profound than diet. Pushing food can become stressful and may not address the underlying cause if the body is genuinely preparing for a larger transition. When significant weight loss persists, the focus may need to shift towards comfort and enhancing the quality of life remaining. This involves honoring preferences. Offer small, frequent meals or snacks that are easy to eat and genuinely appealing. Prioritize enjoyment and nutrient density over volume. Enhancing the dining experience. Create a calm, pleasant atmosphere for meals, reducing distractions. Eat together if desired, but without pressure. Prioritizing hydration. Ensure adequate fluid intake with frequent offers of water, juice, tea, soups, or other preferred drinks. Consulting healthcare professionals. Always discuss significant weight loss with their doctor to rule out treatable causes and get advice on nutritional strategies, appropriate supplements, or potential palliative care focused on comfort. Ultimately, seeing significant unintentional weight loss, especially combined with reduced appetite or weakness, is the body sending a message. Understanding this, while challenging, helps adjust care with clarity and kindness, focusing on compassionate support, ensuring comfort, and making the remaining time meaningful. If you enjoyed this video, comment 1 to let me know. If not, comment 2. Your thought matter to me either way. Following weight loss, another significant sign is a type of deep, lasting fatigue and weakness that doesn't improve much, even with adequate rest. This isn't just feeling a bit worn out after a busy day. It's an overwhelming exhaustion that makes even simple everyday tasks feel incredibly difficult. You might notice your loved ones sleeping much more, needing long naps, or struggling to get out of bed or a chair. Activities they once enjoyed might be abandoned simply because they lack the physical energy to participate. This pervasive lack of energy is a key indicator that something more than normal aging is occurring. What causes this profound level of fatigue? It usually stems from the body starting to conserve its remaining energy as systems slow down. Reduced organ efficiency. Vital organs, like the heart, may begin to pump less strongly. This leads to weaker circulation throughout the body. Decreased oxygenation. With slower circulation, less oxygen reaches the muscles and tissues. Oxygen is essential fuel for energy, so reduced levels naturally result in feelings of weakness and fatigue. Metabolic shift. The body's overall metabolism slows, and it starts redirecting energy away from physical activity towards preserving essential functions. This internal conservation effort contributes heavily to the feeling of being constantly drained. Impact of chronic illness. Many underlying health conditions common in later life, such as heart failure, COPD, kidney disease, cancer, or chronic anemia, inherently cause significant fatigue as the body constantly works to manage the illness. Medication. Side effects. The side effects of various common medications for pain, blood pressure, depression, allergies, etc., can include drowsiness or fatigue, adding to the burden of exhaustion. This deep fatigue impacts more than just the physical body. It takes a heavy emotional and social toll. For someone who valued their independence, losing the ability to perform simple tasks can lead to intense frustration, sadness, or embarrassment. They might feel like they're losing control or becoming a burden. Consequently, they may begin to withdraw socially. Declining invitations or sitting quietly during gatherings might not stem from a lack of interest, but purely from lacking the energy required to participate. This withdrawal can sadly lead to increased isolation. It's also easy for caregivers to misinterpret this fatigue as laziness or lack of motivation. Urging them to push through it often isn't helpful when the exhaustion is this profound. Supporting your loved one through this requires understanding and adaptation, focusing on embracing rest and redefining activity. Validate their experience. Acknowledge that the fatigue they feel is real and significant. Let them know you understand it's not something they can just overcome with willpower. Energy conservation. Help them manage their limited energy. Suggest planning important tasks during times they feel slightly better. Simplify routines and keep essential items easily accessible. Using assistive devices can also help conserve energy. Prioritize rest. Create a peaceful environment and respect their need for extra sleep or naps without making them feel guilty. Forcing activity when their body demands rest is often counterproductive. Adapt activities. Help them find enjoyment in less physically demanding ways. Shift focus to quieter activities, like listening to music or audiobooks, looking at photos, simple crafts, or gentle conversation. Focus on presence. Over performance. Let go of expectations about activity levels. Your calm presence, quiet companionship, and expressions of affection are invaluable forms of support that require little energy from them. Medical consultation. Always discuss persistent fatigue with their doctor to rule out or manage treatable contributing factors like anemia, thyroid issues, pain, or medication side effects. Recognizing this deep, ongoing tiredness as more than just sleepiness is key. It's often a sign the body is undergoing a major change, slowing down and conserving resources. Adjusting expectations and prioritizing comfort, peace, and your loving presence become the most meaningful ways to offer support during this time. The third sign we'll explore involves changes in how your loved one thinks, communicates, and interacts with the world around them. This is about a noticeable decline in their cognitive function and a tendency towards social withdrawal that goes beyond the typical forgetfulness we sometimes associate with older age. What might you notice? On the cognitive side, you could see increased forgetfulness, maybe struggling to recall recent events, forgetting familiar names more often, or losing track of the date or time. They might have difficulty following conversations, seeming lost or unable to keep up. You might find them getting disoriented even in familiar places, like their own home. Sometimes, repetition becomes more frequent, asking the same questions or telling the same stories over and over within a short period. Importantly, this confusion might fluctuate. They could have moments of perfect clarity, followed by periods where they seem quite muddled. Alongside these thinking changes, you might observe behavioral shifts. They may start talking less, becoming quieter and less engaged in discussions. Perhaps they show reduced interest in activities they previously enjoyed, seeming detached or lost in their own thoughts. You might find them spending long periods just sitting silently or sleeping more. It's crucial to make a distinction here. If your loved one has had a diagnosis of dementia like Alzheimer's for many years, you'll already be familiar with progressive cognitive decline. What we're highlighting as a potential sign in the final year is often a newer or accelerating decline in someone who was previously relatively sharp, or a significant worsening of existing symptoms. It's the change that signals something deeper may be occurring. What causes these cognitive and behavioral shifts as someone approaches the end of life? Several factors can contribute. 1. Reduced cerebral blood flow and oxygenation. Just as reduced circulation affects the body's muscles, it also impacts the brain. Less blood flow means less oxygen and fewer nutrients reaching brain cells, which can impair their function and lead to confusion. 2. Metabolic changes and toxin buildup. As body systems like the kidneys and liver become less efficient, waste products that are normally filtered out can build up in the bloodstream, sometimes affecting brain clarity. 3. Infections. This is a critical point, often missed. In elderly individuals, infections like a urinary tract infection, UTI, or pneumonia frequently don't present with typical symptoms like fever. Instead, the first and sometimes only sign can be a sudden increase in confusion or delirium. 4. Medication effects or interactions. New medications, changes in dosage, or interactions between multiple drugs can cause confusion or drowsiness. 5. Dehydration or electrolyte imbalances. Not getting enough fluids or having imbalances in essential body salts can significantly impact brain function and lead to confusion. Alongside the confusion, you might notice distinct emotional and mood shifts. Some individuals become more irritable, anxious, or easily agitated, perhaps because they are confused or frustrated by their inability to communicate or understand. Conversely, others might seem unusually calm, quiet, or apathetic, showing little interest in things they once cared deeply about. This isn't always depression. It can be the brain's way of processing things differently as energy wanes, making emotional expression more difficult or muted. For family members and caregivers, watching these changes unfold can be incredibly painful. Seeing a loved one struggle with confusion or withdraw emotionally can feel like you're losing pieces of them even before they are physically gone. Communication can become challenging and sometimes heartbreaking. During this stage, compassionate communication and creating a supportive environment become paramount. 1. Meet them where they are. Trying to constantly correct their confusion or force them back into reality can increase agitation. Instead, try to enter their world gently. Respond to the feelings behind their words, even if the facts are muddled. Accept their current reality with grace. 2. Gentle communication. Speak clearly, simply, and in a calm, reassuring tone. Avoid overwhelming them with complex questions or too much information at once. Use short sentences. Non-verbal cues like a gentle touch, a warm smile, or simply sitting quietly beside them can communicate care powerfully. Have patience with repetition. Respond calmly each time. 3. Create a safe and familiar environment. A calm, quiet space with familiar objects can be comforting. Reduce clutter. Maintain routines as much as possible. Visible clocks and calendars might help with orientation. Ensure good lighting, especially at night, to minimize disorientation. 4. Managing agitation, anxiety. If they become agitated, respond with calm reassurance. Sometimes distraction with a simple activity, music, or a change of scenery can help. Ensure their physical needs, like needing the toilet or being in pain, are met, as discomfort often fuels agitation. Avoid arguing or confronting them. 5. Support meaningful interaction, even if limited. Connection is still possible. Look through old photos together, reminiscence, play familiar music, read aloud, or simply offer your quiet presence. Focus on sensory experiences that might be comforting. Seeing the bigger picture is vital here. Recognize that these cognitive and behavioral changes are often part of the body's overall decline and the end-of-life process. They are frequently beyond the person's control. Instead of focusing on fixing the confusion, shift your energy towards providing a profound sense of security, peace, and unwavering connection. Even when words fail or minds wander, the language of love, comfort, and presence can still be deeply felt. What does this look like in practice? You may find your loved one seems to catch every cold or flu bug that goes around. More serious infections might become more common, such as pneumonia, urinary tract infections, UTIs, skin infections like cellulitis, or even oral infections like thrush. Sepsis, a dangerous body-wide reaction to infection, also becomes a greater risk. It's not just that infections happen. They often occur more frequently, seem more severe, and take much longer to recover from than they used to. An illness that might have been minor before could now lead to a significant setback. Alongside this vulnerability to infection, you might see that the body's repair processes are lagging. Minor cuts, scratches, or bruises that would have healed quickly in the past now seem to linger for ages. Chronic wounds like leg ulcers might become harder to manage. For those with limited mobility, pressure sores, also known as bed sores, can develop more easily and worsen quickly, posing a serious risk if not managed carefully. This slowed healing is a direct reflection of the body struggling to muster the resources needed for repair. Why does the body's defense and repair system weaken like this? There are several interconnected reasons. 1. Immunosenescence. This is the natural, age-related decline of the immune system. While it happens gradually over many years, this process can accelerate significantly in the final stages of life, leaving the person more vulnerable. 2. Poor nutrition and hydration. As we discussed earlier, decreased appetite and potential difficulties with nutrient absorption mean the body might lack the essential building blocks, like protein and vitamins, needed to maintain strong immune cells and repair tissues effectively. 3. Reduced mobility. Being less active or confined to a bed or chair increases the risk of certain problems. Circulation can become sluggish, fluid can collect in the lungs, increasing pneumonia risk, and constant pressure on the skin makes pressure sores more likely. 4. Chronic illnesses. Many long-term health conditions, such as diabetes, can directly impair immune function and slow down the healing process. The body is already working hard to manage the chronic condition, leaving fewer resources for defense and repair. 5. Compromised circulation. Reduced blood flow means that immune cells, oxygen, and nutrients have a harder time reaching areas of infection or injury, hindering both the fight against germs and the tissue repair process. One of the most critical things for caregivers to understand is that infections in frail, elderly individuals don't always present in the typical way. We usually expect a fever with an infection, but in seniors nearing the end of life, a fever might be absent or very low grade. Instead, an infection might manifest primarily through subtle signs, such as a sudden increase in confusion or delirium, unexplained lethargy or sleepiness, a loss of appetite, or a general decline in their ability to function. Being vigilant for these changes in condition, not just waiting for a thermometer reading, is incredibly important. This cycle of frequent infections can lead to a significant treatment burden and frustration for families. It might feel like you're constantly dealing with rounds of antibiotics, doctor's visits, or even hospital stays. You might also notice that treatments which used to work quickly seem less effective now, requiring stronger medications or longer courses. There comes a point where the benefits of aggressive treatments might be outweighed by the side effects and the stress they place on an already frail body. When facing recurrent infections and slow healing, the focus often needs to shift towards prevention, comfort, and managing symptoms effectively. 1. Meticulous hygiene. Simple measures become vital. Consistent hand washing by caregivers and visitors, careful skin care, keeping skin clean, dry, and well moisturized to maintain its barrier function. And regular oral care can help prevent infections. 2. Nutritional and hydration support. Continue to offer appealing, easy-to-take nutrition and fluids as tolerated, focusing on comfort and enjoyment rather than strict calorie counts. 3. Mobility and positioning. If mobility is limited, frequent changes in position, every couple of hours, are crucial to prevent pressure sores. Even gentle range of motion exercises, if possible, can help circulation. 4. Wound care. Pay close attention to the skin, especially over bony areas. Address any redness or breakdown promptly according to medical advice. 5. Comfort measures for symptoms. Focus on relieving discomfort. This includes managing any pain effectively, using appropriate measures if a fever does occur, ensuring adequate hydration, especially with UTIs, and keeping them comfortable. 6. Palliative care consultation. This can be incredibly helpful. Palliative care specialists focus on quality of life and symptom management. They can help families navigate difficult decisions about treatments, balancing the desire to cure with the need for comfort, and aligning care with the person's overall goals. Understanding the implications of this fourth sign is key. Recognizing that frequent infections and slow healing reflect the body's diminishing reserves helps shift the focus. It underscores the importance of prioritizing meticulous preventive care, managing symptoms for comfort, and making choices that enhance the quality of the time remaining, rather than pursuing potentially burdensome treatments with limited benefit. Finally, we arrive at the fifth sign: noticeable alterations in breathing patterns and clear evidence of reduced circulation. These changes often become more apparent as a person draws closer to the end of their life, serving as clearer indications that the body's essential systems are beginning to slow down significantly. Recognizing these changes helps shift the focus entirely towards ensuring comfort and peace. Let's first explore the changes you might observe in breathing patterns. 1. Rate and depth. Breathing may become distinctly slower and much shallower than what was normal for your loved one. At other times, you might observe periods of unusually rapid, shallow breaths, almost like panting. Both ends of the spectrum can occur. 2. Rhythm. The steady, even rhythm of breathing can become quite irregular. One of the most noticeable changes is the appearance of pauses between breaths, sometimes lasting for 10-20 seconds or even longer. These pauses, known as apnea, can be startling to witness, but are common as the brain's breathing center becomes less responsive. 3. Cheney-Stokes respiration. Some individuals exhibit a very specific pattern called Cheney-Stokes breathing. This involves cycles where breaths gradually become deeper and faster, reach a peak, then progressively get shallower and slower, finally leading into a period of apnea, pause, before the cycle repeats. This dramatic waxing and waning pattern is thought to relate to changes in the brain's sensitivity to carbon dioxide levels as circulation slows. 4. Shortness of breath. Dyspnea. Your loved one might express feeling breathless, or you might observe them appearing to struggle for air, even when resting or with minimal effort, like turning over or speaking a few words. They may need to stop frequently to catch their breath. 5. 6. Noisy breathing. As the person weakens, they may lose the ability to effectively cough up or swallow normal secretions, like saliva, that gather in the back of their throat and upper airways. This can lead to breathing sounds that are moist, rattling, or gurgling, sometimes referred to as the death rattle. While this sound can be very upsetting for family members to hear, it's crucial to understand that because the person's level of consciousness is typically low at this point, it is generally not believed to cause them distress or pain. It's more a sign of the relaxation of throat muscles and the inability to clear secretions naturally. 7. Fluid buildup, pulmonary congestion. Sometimes, fluid can accumulate in the lungs themselves, especially if there are underlying heart or kidney issues. This might lead to a persistent cough, sounds of congestion deeper in the chest, or a feeling of tightness. Lying flat may become uncomfortable. Alongside these breathing changes, you are likely to see clear signs of weakening circulation. 1. Temperature. The hands, feet, arms, and legs may feel noticeably cool or even cold when you touch them. Even if the room is warm, the extremities lose heat as the body conserves blood flow. 2. Skin appearance. The skin, especially on the hands and feet but potentially spreading up the limbs, might look pale or develop a bluish or purplish tint, cyanosis, particularly noticeable around the lips and nail beds. Another common sign is mottling, where the skin takes on a patchy, lace-like pattern of reddish or purplish discoloration. This often starts on the soles of the feet and can gradually move up the legs. 3. Underlying cause. These visible changes occur because the body, in its final stages, automatically prioritizes sending the limited blood supply to the most vital organs, the heart, lungs, and brain, reducing flow, perfusion, to the skin and extremities. This reflects the heart working less efficiently as a pump. Here are essential comfort measures to focus on. 1. Positioning. Simply elevating the head of the bed with pillows often makes breathing feel less effortful. Supporting arms and legs with pillows can also increase comfort. Some people are most comfortable sitting upright or even sleeping in a recliner. Find the position that seems to provide the most ease. 2. Environment. Keeping the room cool and ensuring gentle air circulation, perhaps from an open window or a quiet fan not blowing directly on them, can often relieve sensations of breathlessness. A calm, peaceful atmosphere is always beneficial. A humidifier might soothe dry airways. 3. Managing secretions. If breathing is noisy due to secretions, gentle mouth care with swabs to moisten the lips and mouth is important. Sometimes, carefully turning the person onto their side allows secretions to drain from the mouth. Medications to reduce secretions might be prescribed, but simple measures and reassurance are key. 4. Oxygen therapy. Oxygen might be offered via nasal prongs, primarily to ease the feeling of breathlessness if it seems distressing to the person. However, it doesn't always change the underlying process and may not be needed if the person appears calm and peaceful. Decisions should focus on comfort. 5. Hydration. Offer small sips of water, juice, or ice chips frequently if the person is conscious and can swallow easily, primarily for mouth comfort. Don't force fluids if they are unwilling or unable to take them. 6. Reassurance and presence. Never underestimate the power of your calm, loving presence. Speaking softly, holding their hand, gentle touch, or simply sitting quietly nearby can profoundly reduce anxiety and offer immense comfort and a sense of security. At this stage, the focus moves entirely away from fixing or curing, concentrating wholly on ensuring the person feels safe, comfortable, cherished, and surrounded by peace and love during their final transition. So, we've walked through 5 key signs: weight loss, deep fatigue, confusion, weakened immunity, and changes in breathing or circulation. Remember, these are signals, not a strict timetable. They appear differently in everyone. Understanding these signs isn't about fear. It's about being prepared. This awareness is a gift. It helps you provide better care, make informed choices, and ensure your loved one experiences their final months with love and dignity. It's a time to cherish moments and share memories. If you're seeing these signs now, take a deep breath. This journey is difficult, but you are not alone. Many families walk this path. Knowing what to expect can bring strength and peace. Please remember to care for yourself too. Cherish the time you have, express your love, and know that your presence makes a difference.